We felt that there wasn't a system that we could go around the patients just to make sure that they were comfortable, just to make sure that they had enough nutrition and hydration.
Relatives often feel that when their loved one comes into hospital, a lot of their concerns are around the care that we can give to that relative. And many of their concerns are about, are they having enough food? Are they having enough drink?
This is the Transforming Care Board for Evington. We've brought in quite a few changes over the last few months. Firstly, nutrition's a big issue and weekly weights and things have been implemented to improve patients' nutrition. We've got the safety crosses, so we can pinpoint how many falls or pressure ulcers have developed on the ward. And this is the intentional rounding. This is when we go around to see patients on a 2 to 3 hourly basis, depending on the green or the orange star.
We brought in intentional rounding charts, and these charts stay with the patient at all times. They're clipped on the end of their beds, and what we do is we go around each patient and we check them periodically. We check their pressure areas. If they need to be turned because they're unable to reposition themselves, we will reposition them.
We've spread across to over 50 clinical areas of wards, both in the acute and community, and including our emergency department.
We were asked to look at the way that we prevent pressure sores in the emergency department. We took the rounding charts and just changed a few things, sat down as a group of staff, see if that would work, and then implemented it with the rest of the staff. The rounding chart's been one of the easiest things to implement in the emergency department. The staff have been very receptive to its use.
By using the charts, it acts as a prompt and a reminder for all members of staff. They can easily check when this patient was last repositioned or given a drink.
I feel that with the introduction of other personnel as well, such as our ward housekeeper, we are able to provide a more holistic service for the patient.
We now give them biscuits every time we give them a cup of tea. I do the tea rounds at 10 and we do them at 12 and we do them at 2, and we offer them biscuits as well as their meals as well. So that includes for nutrition wise to include in more calories for them through the day.
People are also getting more attention than they would have done previously. From a patient perspective, from a staff perspective, I feel that it gives staff the confidence and the ability to be able to go to every patient who needs attention and go through the list of requirements just to make sure that everybody has been attended to properly.
We have the protected meal times at meal times because we don't want people in and out when they're trying to eat their meals, and of course that's enforcing their dignity then.
There's been a lot in the media about hospitals, actually patients becoming emaciated and malnourished in hospital, and this seems to be reassuring the relatives that yes, we are addressing these issues, and nutrition and hydration are very important to us.
Staff can see what a difference it is making for the patients, that they are passionate about improving the patient journey, and intentional rounding is just one simple part of that journey that the patients are on.